this video is looking at you guys, and then the interpreter is going to pop up on that screen. And this is mobile, so you can move it and turn it depending on where the patient is, if they're in a bed or you walking around with them.
Interpreter 53005, I will be translating for you today. How are you?
So the interpreter is writing on the screen that the doctor wants to tell the patient how to take their medication, so we ask them to take this 3 times a day. So if a patient can read and write in that language, they'd be able to note it down on any instructions that were given to them in English. So they would have that information in their language as well. All our consent forms are translated in different languages. Most of our patient education is being translated into different languages depending on what the patient speaks and the population that we see. And that right there is the interpreter ID number. So if we ever had to get a record of who we were communicating with for different scenarios, we'd have access to that as well. We're actually going to do a test with a patient and a provider in our hospital, okay? For video interpreting. Can you just tell me where you're located?
We're located in Costa Rica.
Costa Rica. Okay, so they're all over the world.
How are you feeling, Miss Sonia?
Buenos días, Sonia. Soy la intérprete. Todo lo que dice se interpreta y se mantiene confidencial. ¿Cómo se siente hoy?
Me siento muy bien.
Okay.
I feel great.
All right. So I'm gonna just ask just for the demo purposes, so we can see that whatever is written on the screen and she can understand. So, for example, take your medication once a day.
Su medicamento estoy bien.
Yeah, she can read it perfectly. Take
Okay.
her medication twice a day.
So as you can see, instead of me, if the patient has difficulty, hearing difficulty, so she can actually read. At the same time, she can see an actual person, I think is a tremendous advantage. This is a typical interaction that we usually do with the patients, and patient's family usually help us translate too, as you can see. But we are trying to use the machine most of the time.